warm welcome to all. So this is a session about implantable materials and healthcare and hygiene textiles. So in this video we are going to discuss about this one. So introduction to implantable materials used inside the body for repair, replacement or support. So mainly it is concentrated on implanting, that is we are including something in the human body. So but it is done from medical textiles. So we are using some textile materials based on the human body. It was designed and it was fixed inside the body and it was supported. So first one is used inside the body for repair, replacement or support. So we can repair the place or replacement. So we can use somewhat a replacement or for support or supporting the particular place. The main concept is repair, replacement or support. Second one is biocompatible and non-toxic durable. So it is should be a biocompatible and non-toxic. It should not be a toxic one, or it should not have a infecting, or it should won't affect the place, or it won't cause any discomfort to the user, and it should be a durable one. So it will be somewhat to be a long lasting period. It should be withstand for a particular period. Main concept is this one. So the next one is classification of implantable textiles. So what are all the classifications? So how we classify those things? First one is soft tissue implantable. Second one is hard tissue implantable. Third one is biodegradable implantables. So the first one is soft tissues, which means it was having a somewhat a very soft, like inside our body there is some tissues are there. It was somewhat very soft. So if we are getting operated in some particular places, these soft tissues implantable will support on that particular place. That is mainly in your stomach or in your uterus. In case of in going with men, so there is some very sensitive places are there. So we have to use those in mainly in your face. So it is soft tissue implantable. Second one is hard tissue implantable, that is in our joints, that is in our knees, in our ankles, there is somewhat hard tissues. So that supporting those hard tissues implantable, we can use this one. Third one is biodegradable. So biodegradable name means if we are using some biodegradable implantables, it will be absorbed by our body itself. Mainly it is the sutures. So if you are getting some wound, the sutures has been done on particular place. So that sutures will be automatically absorbed by our body and it will get dissolved by our body itself. So we won't go to hospital, and again we don't need to get the stitches open. So it is the main concept, that is biodegradable implantables. Examples, that is sutures, vascular grafts, artificial ligaments, hiranya mesh, artificial skin, heart valves. In angio test they use some stents. It is somewhat a textile material and it is a soft tissue implantable. So it will the stent, and in angio they use the stent in the particular block places to avoid that. It is main concentration in soft tissues. So these are somewhat examples of implantable materials. Fibers used. What are all the fibers used in the implantables? So mainly it go on with non-woven and man-made materials, so to give an withstandable one. So the polyester, polypropylene and collagens, chitones, and if we are going with natural, it is mainly concentrated on silk. Textile structures. What is the structure included? What are all the fibers? Those are given in before slide. Next one is textile structures. That is the knitted fabrics. Knitted fabric is nothing but knitting materials. Next, braided structures, that is by handmade, and the non-woven scaffolds, woven fabrics. All the concepts are being used. All the structures has been included. Next one is required property. What are all the properties required? Biocompatibility, strength, stability, flexibility, controlled biodegradation. So those are somewhat main key features, main key properties required for a implantable textile material. Application of implantables, where we can include cardiovascular, orthopedic, plastic surgery, dental implants, tissue engineering. So we can go on with those, mainly we concentrate on implantables in this concepts. Healthcare and hygiene textiles used for comfort, infection control and cleanliness in healthcare settings. So mainly we concentrate on comfortable infection control. So the two concept is the main idea of healthcare and hygiene textiles. So what are all the categories on healthcare? First one is surgical textile, hospital textile, hygiene products, barrier textiles. So the surgical is nothing but we are going with what are all the things used in a surgery places. Hospital textiles in name is how the surrounding has been covered with textile, that is drapery, screens, beds, bed covers, pillows, bed sheets, the patient using screens, what are all the covered using materials. Next one is hygiene products, that is a disposable one. What are all the patients using in the surroundings, it will be comes under hygienic product. And barrier textiles, that is if you are traveling some places from in hospital, they use some what is called structures, everything, so it will be covered with some textile material, but it should be in a barrier textile. Examples are bed linen, gown, drapery, scrubs, curtains, etc. Hygiene textiles comes under diapers, sanitary pads, adult inconsistent products, that is diapers for old age peoples, and wipes. Next one is material used is cotton, polyester, polypropylene, rayon, antimicrobial fibers. So somewhat is having a character of antimicrobial fibers are mainly used in this concepts. Manufacturing techniques. So we can go on with the non-woven weaving, knitting, and spun-born and melt-blown. It is the non-woven concept. Next one is required property. What is the main key properties required for that? It is absorbency, softness, breathability, fluid resistancy, antimicrobial. So those 5 key required properties. Innovation. So what are all the nowadays innovation is antiviral textiles, biodegradable pads, smart monitoring fabrics. So we can go on with smart textiles in the healthcare. Next one is comparison. So the implantable, what is we are going with inside the body, long term, high complexity. Hygiene textiles is external, comfort based. So mainly this is the concept of implantable and healthcare hygiene products. So the implantable supports the surgical needs, hygiene supports ensures the safety and comfort. So the implantable is mainly concentrated on surgical needs, and the hygiene is around the surrounding of the patients or overall around them. So mainly this is the concept of implantable and hygiene textiles. Thank you.